Despite Australia being one of the healthiest nations in the world, Aboriginal and Torres Strait Islander people suffer from a significant gap in health outcomes as a population, with life expectancy 9 to 11 years less than non-Indigenous counterparts. Chronic disease, such as cardiovascular disease, type 2 diabetes, and kidney failure, contributes by 80% to the disparity of health outcomes between Indigenous and non-Indigenous people. These issues are further complicated by a range of underlying social determinants and high-risk behaviours that negatively impact on an already disadvantaged population. In 2015, 34.9% of Indigenous people were current smokers, compared to just 12.9% of the non-Indigenous population. 39.6% of Aboriginal women smoked during pregnancy, compared with the low 8.2% of non-Aboriginal women. In 2015, 40.1% of Aboriginal people aged over 16 in New South Wales consumed significant levels of alcohol that posed a lifetime risk to health. 53% of Aboriginals in New South Wales were not consuming a sufficient amount of fruit each day, whilst 92.8% did not eat the recommended amount of vegetables per day either. When combined with a lack of access and availability to culturally sensitive healthcare services, it has led to low levels of engagement within the Indigenous community to effectively manage their chronic diseases. Historical trauma, combined with the high rates of chronic disease, has also led to widespread mental health issues within the Aboriginal community. It is estimated that 33% of all Aboriginal people experience high levels of psychological stress, more than twice that of the non-Indigenous population, while almost a quarter of the entire population report having a combination of both mental and chronic health problems that have significantly impaired their overall life satisfaction when compared to other sections of society.
There are a number of behavioural risks in which have contributed to the poor health of Indigenous Australians. Aboriginal people have a higher participation rate in risky health behaviours, and this has been a leading factor as to why Indigenous Australians' health levels are far below those of non-Indigenous Australians. According to the South Western Sydney Local Health District's Aboriginal Health Plan for 2017 to 2021, in 2015, 34.9% of Indigenous people were current smokers, compared to 12.9% of the non-Indigenous population. 39.6% of Aboriginal women smoked during pregnancy, compared with the low 8.2% of non-Aboriginal women. In 2015, 40.1% of Aboriginal people aged over 16 in New South Wales consumed significant levels of alcohol that posed a lifetime risk to health. 53% of Aboriginals in New South Wales were not consuming a sufficient amount of fruit a day, whilst 92.8% did not eat the recommended amount of vegetables per day. These are not new issues facing the Indigenous community, with health challenges negatively affecting Aboriginal populations from the very beginning of colonisation, when introduced diseases and loss of land devastated local populations. National Aboriginal Community Controlled Health Organisation, 2018. Historically, the Indigenous people of Australia have faced a range of social and economic hardships introduced from non-Indigenous Australians, with significant negative cultural events such as the stolen generations, forced removal from their traditional lands, and assimilation causing historical trauma reaching across generations, according to Wesley Esquimaux. The overhaul of Australia when the British first arrived on Australian land made a significant impact on the health and well-being of Indigenous Australians. New diseases and food were brought from a westernised country and introduced to the land. As a result of this, Indigenous Australians were forced to change their ways of living and no longer live off the land as they had done for many previous years. This was a major point in which the health of Indigenous Australians dropped below that of non-Indigenous Australians, and since has continued into the present day. With spiritual and natural connectedness, as well as Indigenous Australians' inextricable connection to the land playing such a vital role in traditional Aboriginal and Torres Strait Islander culture, the historical dismantling of such traditions has had a traumatic effect on the health challenges facing Indigenous people to this day.
Access to health services is detrimental to maintaining the quality of life of all people. With the average life expectancy of Aboriginal and Torres Strait Islander people, according to the Australian Institute of Health and Welfare, being 10.6% lower than those of non-Indigenous population born in 2010 to 2012. This access to health services is extremely important in closing the gap of life expectancy. Discrimination is a major boundary to Aboriginal and Torres Strait Islander people when accessing health services. Due to inhumane historical events regarding the stolen generation and the belief of white superiority, tension between the two populations is often evident when providing or being provided with healthcare. Many Aboriginal and Torres Strait Islander people are hesitant or refuse to access health services which are provided by non-Indigenous people due to discrimination towards this population by healthcare providers. According to the Australian Government, some health services fail to deliver care to all without discrimination. It has been found that, compared to non-Indigenous clients with the same medical needs, Indigenous clients were about 1/3 less likely to receive appropriate medical care across all conditions. This has a major impact on the mental and social well-being of Aboriginal people and creates a division between the Indigenous and non-Indigenous population, causing distrust and rivalry. This is portrayed through the Australian Health Ministers Advisory Council's research findings, which state that among Aboriginal and Torres Strait Islander people who had problems accessing health services in 2008, 7% said that it was because they were not culturally appropriate, and 10% said they didn't trust services. This display of racism towards Aboriginal and Torres Strait Islander people leaves this population unwilling to access health services despite needing to in order to maintain a healthy standard of living, and this in turn has a major impact on the health gap between Indigenous and non-Indigenous people.
Similarities and differences between the Darug people and Chinese Australians and their health experiences. Similarities. Both groups lack knowledge and understanding of available health services. They also have language barriers, so they speak in their own native language, so poor English skills may deter them from using mainstream healthcare services and be at risk of lower social and economic outcomes. Racism is prevalent, so they become reluctant, avoid the public, and avoid engaging with services because of the fear that they may be misunderstood, stereotyped, or judged. Mental health is also not recognized, so services are available. Another report suggests that Chinese have low mental health literacy. Also, there's inadequate communication because both groups have not been accustomed to Western culture. Lastly, Western Sydney region has many hospitals, public hospitals, and healthcare services. The Darug people and many Chinese people also reside in this area. Differences. Both groups have different perceptions of health and Western medicine due to their health beliefs and practices. The Chinese believe food, illnesses, and medications can be judged by hot or cold, whereas the traditional health beliefs for Aboriginal people are that they believe in the mind and body can be treated by healing songs or bush medicine using plants that are grown in local areas. Aboriginal people also have poorer birth outcomes due to smoking, alcohol, substance misuse, and assault. Aborigines also experience poorer outcomes from cancer, as Aborigines don't want to be removed from their homes to receive health care. Lastly, Chinese prefer either general practitioners of the same ethnic background, whereas Aboriginal members want to have a respectful, non-judgmental, and positive attitude when you work with them.
As an exercise physiologist, it is important to encourage Indigenous Australians to participate and engage in physical activity. Physical inactivity is one of the major leading risk factors among the Indigenous population. This not only directly affects the fitness levels of Indigenous Australians, but also contributes to other diseases, such as heart disease and diabetes, two highly prevalent diseases in the Indigenous Australian population, according to Exercise and Sports Science Australia. It is important that exercise physiologists use their knowledge about the benefits of exercise and physical activity to encourage and engage with Indigenous communities in order to try and improve their physical health levels, which in turn contributes to improving their overall health levels.
A podiatrist approach to help the Darug people. The Podiatry Board of Australia aims to achieve equality positive health outcomes, and closing the gap by 2031. Firstly, as podiatrists, we specialize in the foot, ankle, and the lower limb. We can prevent, diagnose, and treat many conditions as we play a major role in lower limb support. In the article Australian Aboriginal Studies, it stated that Aboriginal footwear lacks support, so it is important to acknowledge their culture, their local knowledge on footwear, so we can educate and support them by introducing more suitable footwear for daily use, such as during exercising or walking. Another Indigenous program promotes healthy and strong feet, provides education, free services, and podiatric care.
Aboriginal and Torres Strait Islander people are shown, through research, according to the Australian Heart Foundation, to be 70% more likely to die from cardiovascular disease, a disease that is highly preventable simply through a healthy diet and frequent exercise. As someone working in the sport industry and studying the science of sport and exercise, my platform and professional skills can be used to reduce the risk of developing cardiovascular disease within the Aboriginal and Torres Strait Islander community by encouraging healthy habits to be included in their everyday lifestyle. Providing education on the effects of what simple exercise and healthy eating does in regard to positively improving the physical, social and emotional well-being of an individual, but also informing the consequences of unhealthy habits, which may already be included in their lifestyle, can encourage this population to take action on their health.
It is reported that Aboriginal and Torres Strait Islander Australians are 3 to 6 times more likely to developing diabetes-related foot complications and more likely to have lower limb amputation compared to non-Indigenous Australians. Building trust is the main element to Indigenous health. Podiatrists are considered to be an essential component in non-judgmental and cultural sensitive care, communicating honestly and openly, providing holistic care, and working within the Aboriginal customs. A podiatrist have a key role to the management of lower limb extremity complications, preventative screening, treatment, diagnosis, and most importantly, patient education. For the management of diabetic-related foot complications in the Indigenous population, podiatrists work in an integrated manner by a multidisciplinary foot care team, including nursing, medical, and other allied health professionals. Therefore, this collaboration and support attributed closing the gap in health outcomes. Podiatrists should work in partnership with Aboriginal people so that a strategy can address in the right areas, respectful and culturally appropriate.
As a paramedic, we are often the first point of contact for those requiring health services. By acknowledging and understanding the cultural challenges facing Indigenous Australians when accessing healthcare, it is an important first step in closing the gap in Indigenous health outcomes by directing those individuals in need towards the right services to effectively manage their healthcare needs. For those already in the healthcare system, an extended care paramedic scope of practice would be the most beneficial in effectively managing the healthcare needs of those suffering from long-term chronic diseases. Developing empathetic and culturally sensitive healthcare relationships with those struggling to access healthcare services, such as Indigenous Australians, extended care paramedicine can play a vital role throughout the community in reducing the barriers facing the different cultural sections of society to ultimately improve the health outcomes for all involved.
We acknowledge there is a whole range of social determinants that impacted an increased obesity among Western Sydney Aboriginal and the Darug people, but we are just focused on health and social services in our strategy. Our strategy is adopted from the National Centre of Indigenous Excellence in Redfern, Sydney, to reducing weight, promoting healthy lifestyle choices, and to closing the health disparity gap between Darug Aboriginal people and non-Indigenous. We have adapted promoting a community-based fitness program like Aboriginal traditional games to help combat obesity and encourage families, individuals, and community groups so they can make healthy lifestyle choices. Physical activity is not seen by many Aboriginal people as a benefit. However, the traditional activities help shape the values of Aboriginal and improve physical activity levels, as well as contributed to the strength of Aboriginal culture. Thus, working in partnership with the Aboriginal people for promoting the healthy lifestyle and weight enhance Aboriginal people health and well-being. Therefore, our strategy support Article 1 and 25 of human rights. In Article 1 is about the right self-determinations. and Article 25 is about right recognized. Therefore, our strategy will make sure consultations, contributions, and appropriate participation in decision making for Aboriginal Western Sydney. In conclusion, our strategy may serve to improve Aboriginals' lifestyle and physical activity. However, the impact of a specific historical aspects, such as colonizations, displacements, are determinants of Aboriginals' lifestyle that can be attributed to social inequalities experienced over time.